Hello all, and welcome, and thanks for joining us today. As you know, I'm David McNicol. I'm head of sales for our multiples channel here at AAH, and I'll be hosting our discussion today, really exploring the impact of the recent crisis and challenge that pharmacy's gone through these last number of months, if not years, in truth. We'll take a look at the challenges and how the sector has responded. And look at the positives and reflect really on that critical role of pharmacy in all our communities. I'm pleased to say I'm actually joined with Ashley Cowen and our independent pharmacy owners, so Yashar Alani and John Davey.
Hi there.
So if we just get started, Yashar, can you just give me a little summary really of your business?
Yeah, so I'm the managing director of Shoebury Pharmacy Group, which is a collection of 3 pharmacies based in Shoebury Ness, which is where the Thames estuary meets the sea. It's made up of the 3 pharmacies, one being right next to a health centre. We operate a hub and spoke model, even on a small scale, we make it work. What's actually unique about our business is that out of the 4 pharmacies with NHS contracts in the Shoebury Ness region, we have 3 of them. So yeah, that's us.
Excellent, great. And John, up there in Liverpool.
Yeah, well, I've got 5 pharmacies here in Liverpool. I work closely with my sister, who's got another 2 pharmacies, and we share the management skills. We've got different strengths and weaknesses. She's got the strengths and I've got the weaknesses.
I've met you both, and you're probably right there, John.
Yeah, probably. Community pharmacies. So we're in amongst the chimney pots in central Liverpool for 2 of them. And then the others are more associated closely with health centres. So we've a mix and a range of businesses. We've diversified to some degree, which has carried us through when pharmacy has been poor for us over the last number of years. And that's managed to buoy us and keep us going. But we're aggressive, dynamic, thoughtful, and we're pretty fleet of foot, I think.
Really
and we've had AAH as our business partners for, 20 plus years now. Gladly.
I think the interesting in the respect of the type of businesses and where they sit in the communities will give us some useful insight into actually how you've probably managed through this difficult time. And I wonder if I come to you, Yashar, and just ask around actually the challenges that you've faced running the pharmacy or the pharmacies.
Well, if we put a line in the sand, pre-lockdown, post-lockdown. Pre-lockdown, I think, John, you'd admit that it was absolutely mental. Those 4 weeks leading up to, people going into lockdown, all the shielded customers that we had having to, protect themselves. It was essentially like 3 Christmases in one go, whether that was retail trade, prescription volume, the time needed from me personally or my team of pharmacists to, help with the shortfall of frontline healthcare workers in our community that patients had access to actually have a conversation about their ailments. Because what we found was that doctor surgeries, dentists, physiotherapists, all of the ists, if you can say, they were dropping like flies when it came to the lead up to going into lockdown, because whether they themselves as a business had somebody who was a potential COVID sufferer, they'd lock down, which would mean that it would be an extra pressure for the pharmacy community to pick up with that. So yeah, it was just a mix of the uncertainty as well. I think the uncertainty because everything was so vague, I felt, going up to lockdown as to when it was going to happen, what the actual official government advice was on a lot of things, and that kind of panicked a lot of customers as well as the doctor surgeries themselves. I mean, GPs were prescribing more frequently. The prescription cycle certainly shortened. Their software is built in so that they only allow for a certain number of tablets to be dispensed or prescribed in a certain period of time. So that actually, I felt, was shortened. So we were getting customers that had only just had prescriptions put in, 2 weeks before. Normally it would take them 4 weeks to get a renewal. We had them coming back again. So it was a double whammy pre-lockdown on the 23rd of March. Post that, our biggest challenge was just retaining the customers, because obviously over the 10 years we've had the businesses, we've been working hard to make sure that we put a big footprint on our community in terms of the quality service that we provide, being pillars of the community, and being the first port of call for any issue relating to healthcare. And so post lockdown, there was a lot of worried customers, I can put it that way, where how are they going to get their medicines if they had to stay indoors? But that was a big challenge for us. I don't know what you thought about that, John. Was it the same for you?
Yeah, we all of that. I just felt that we were holding the door open and holding the shop together and holding the staff together, and there was only us and the supermarkets open. The GPs were shut.
John and Yashar, did you manage to keep all your pharmacies open the whole time, or did you have to close at any time?
Thankfully, yeah, we did. Thankfully, I think, touch wood, we did.
we were open all the time.
Great, that's good to hear.
But we also found was GPs starting to do 3-month prescriptions. So I'm a primary care network leader, so I spoke to the clinical director and helped them and advised them, and managed to curtail that